the goal of this test is to help the heart transplant surgeon to predict the outcome of the heart transplantation. And basically, why this is significant? And in the past, we probably know, or at least our understanding is, if you have a patient come in to have a transplanted heart, the surgeon have to invite the patient come back to the surgical ward to take biopsy, maybe a week after the transplantation, a month, or maybe a few months. And we all know how difficult and how painful, how cost intensive also procedure. So and then with an autopsy, pathologists can look at under the microscope and evaluate the sort of the morphology of the heart, cell morphology of the heart, and have some kind of prediction. And now with this molecular-based testing, we don't need to do that anymore. What we could do, the surgeon could simply request a blood test, draw a 3 to 5 cc of blood, send to the laboratory, and now then this individualized molecular testing being carried out and looking at this 20 gene profile. And then after the test result coming out, will be a calculation based on the bioinformatics and statistical model. My understanding is at the end, you're just coming up with this one so-called composite index. So there's a number, essentially. And if the number, I don't remember the exact number, and if the number is above 30, and basically you can tell your patient, say, you're fine, go home and enjoy life. But if the number is less than the cutoff, and you better keep the patient in the hospital to watch out, because this heart may have a little problem. And another one, a second example, is to prediction or prognosis of breast cancer therapy. And there are two tests on the market. One is kind of Oncotype DX, which is also array based on 21 gene profiling. That's another one from Europe called MammaPrint. It's FDA-approved test. It's based on 70 gene profiling. Basically, the goal is the same. That is to using this molecular profiling result to predict whether or not this particular breast cancer treatment of a particular patient have a poor outcome or a better outcome. Prognomics.
Now, imagine that a patient goes into the office of the general physician. What is your advice for those who are interested to use such molecular tests? Sometimes general physicians are not prepared, or they cannot know all the tests available out there in the market. What is the reality? What are your thoughts?
You have raised an excellent question, and individualized molecular testing that is used in personalized healthcare and personalized medicine is very, very exciting. It's revolutionary. However, this area is still in the early phase. Many of the tests I'm talking about here are either in the research stage or in the sort of a translational stage. Only very few of them have been FDA approved. So as a general doctor practitioner, that particular doctor has to be extremely cautious before he or she can decide to using this type of individualized molecular testing for personalized medicine. So really, my advice is the physician really have to know the test through inside out before he or she can decide to use this type of test.
If they know what the test is and it is going to be useful, what a patient can expect to happen in the office? Can you describe, I come in, what happens next? What are the steps that one would go to have the results from such a test?
Well, there are two scenarios here. One is what's going to happen today, and the second is what will be happening in the future.
Okay.
What happened today is if you come in with a particular condition, as I said, depend upon what condition or disease we're talking about, And certain, I would say, probably most majority of the treatment we are still carry out following the current medicine that we described, because there is no individualized molecular testing, or we have not yet learned enough information about individual genetic variability to a particular treatment. So therefore, the patient probably won't expect much beside what you normally expect from a common practice. Second are the few of the diseases we're talking about: colon cancer, non-small cell lung cancer, melanoma, breast cancer, name a few. And some of those cancer or diseases, now we do have individualized molecular testing that can associate it with, as you called earlier, called companion diagnostic or synergistic diagnostic method, that now the patient could expect now they be treated based on their his or her own genetic information, which would be great news. And of course, now let's talk about future. And
okay.
I'm a professor in medical school. I teach medical school students. And, when I teach, freshman medical school students, I'm actually try to encourage them. I basically say, now by the time you graduate from medical school, go through residency, fellowship, and become an attending physician or practicing physician, and you might actually have to treat your patient in an entire different way. For example, this is my personal imagination, and when you have a patient come into your office for the first time, and he or she may actually bring a little card, just like the credit card we carry in our pocket. And that card, the difference is the entire genomic information of your patient. And now you can plug in that card into your computer, and then you can locate the information before you prescribe the medicine, just like we described the 3 different categories. And now you can, based on the information, you can say, yes, this drug is good, and this drug may not be good, or this is the dose I should use. And when you treat that patient, you might actually can prescribe or request certain to actually help the physician, the patient, to prognose or predict the outcome of that particular treatment.
Thank you very much. Thank you for being a guest on the show. Our guest was Dr. Richard Zhao, and the topic was individualized molecular testing for personalized medicine. Thank you again.
It's my pleasure. Thank you.